Hi, so today we'll be talking about chronic traumatic encephalopathy, or CTE for short. CTE is a neurodegenerative disease. This is only diagnosed post-mortem. So if an individual is suspected of having CTE, then they will do an autopsy on them. And what they're looking for is tau protein buildup around the blood vessels, in which we'll talk about tau proteins in a second. Excuse me. CTE is most commonly seen in athletes or in veterans. This is due to multiple blows to the head. It is suspected that it is due to multiple blows to the head. This can also be seen in individuals that may have developmental disorders, and they say that from these people may be banging their heads against the wall. This also may be seen in patients that suffer from epilepsy or seizures, or individuals that may suffer from physical abuse throughout their lifetime. It is believed, again, that CTE is caused by multiple brain injuries. So when you sustain a brain injury, there is some displacement and distortion of the actual neural brain tissue from impact. They also believe maybe concussions, multiple concussions, same thing as a brain injury or a mild traumatic brain injury. As you see in this image, this is a normal brain, and this is a brain that is actually has suffered from CTE. So you see that the brain tissue has actually shrunk, and around the corpus callosum area, you see the really shrinking. In this area right here, you can see a lot of those red tau proteins. The red is from the stain itself, and that is how they are actually building it up. So when an individual is suffering from CTE, again, it's not diagnosed until post-mortem, but there may be some signs and symptoms that are suspected of individuals suffering from CTE. These can include depression, anger, suicidal, homicidal ideations. It can also include some motor impairments, such as tremors or difficulty walking, difficulty speaking. There may also be some visual problems, being able not to see appropriately. They may have some short-term memory problems. These individuals, you'll also often see a change in their behavior. Sometimes why these individuals are alive, this can also be misdiagnosed as dementia or possibly PTSD. In this photo, you also see another buildup of tau proteins. Here's all the red stains of the tau proteins, and they all kind of cluster around. This is the blood vessel, so you'll see a little clear white spot where this arrow is pointing. And again, you'll see it over here. These are a buildup of the tau proteins. Currently, there is no cure for CTE. Research studies are still ongoing to try to even be able to diagnose it, why individuals are still alive. There are preventative measures that you can take, which is just trying not to sustain multiple blows to the head. Wearing helmets while playing sporting events. Again, this is commonly seen in athletes. You most likely see it in the football, hockey, soccer arena. The most common famous individual that has recently been diagnosed with CTE is an NFL player, Aaron Hernandez. He was all over the news. He was currently serving jail time for murder. He ended up committing suicide. Once they did an autopsy, they realized that he was actually a stage 3 in CTE. There are 4 stages within CTE. Another preventative measure would be actually fully recovering from a concussion, so taking that time to fully rest. Guidelines for recovering from a concussion is 7 to 10 days. They tell you to stay hydrated, avoid caffeinated beverages, avoid playing video games and watching TV. Try not to do anything cognitively anything that requires a lot of cognitive involvement. So don't go and writing a paper or anything. There's a lot of studies going on with CTE involving within the NFL world. They have millions of dollars of grant money trying to research and find technology that can help actually identify CTE using CT scans, MRIs, and PET scans. And that is all. And here are my references. Thank you.